Your first FY1 shift can feel absolutely terrifying. Your bleep goes off every 6 minutes, someone wants you to prescribe fluids, another patient has chest pain, a nurse says someone just doesn't look right, and somehow you're also expected to rewrite a drug chart, order scans, answer calls, and remember whether you've eaten today. So in this video, I'm going to go through the medical and non-medical things I've seen help new FY1 doctors survive those first few months, and generally feel more confident on the wards. Welcome to the FY1 Survival Guide. So, Part 1. The FY1 Mindset. The first thing you need to understand is this. Nobody expects you to know everything. Seriously. Sometimes new FY1s think they're supposed to function like a registrar on day one. You're not at all. Your job is not to be perfect. Your job is to be safe. That means recognizing when someone is sick, doing basic assessments, starting simple management, and escalating appropriately. Honestly, one of the most dangerous things an FY1 can do is pretend they understand something when they don't. Seniors would much rather you ask 10 questions than make one avoidable mistake because you were too scared to ask for help. And I promise you, every doctor you think looks calm and confident now once had their own first terrifying chest pain bleep at 2 a.m. And a little secret, a lot of the time, confidence doesn't always mean good when you're in FY1. It's important to check and double check your work. Part 2. Non-medical survival tips. Learn where things are. This sounds stupidly simple, but one of the best things you can do early on is learn where things actually are. Because at some point during your first on-call shift, someone will ask for an ECG, a venous gas, a bladder scan, a cannula, or something as simple as printer paper. And suddenly, the entire hospital becomes a side quest. So, early on, learn where the ECG machines are. Learn where blood gases are done. Learn how to print labels. Learn how to request scans. And learn how to contact different specialties. Your FY2 colleagues are perfect here because they've been in your shoes not long before. The less mental energy you waste navigating chaos, the calmer you'll feel. Be friendly with nurses. This one is massive. It can really make or break how stressful ward life can be. I'll say it again, be friendly with nurses. Experienced nurses know more than you do. They can tell you which patients are deteriorating, which consultants want what, how the ward works, and which things actually matter urgently. A good relationship with the nursing staff will save you enormous amounts of stress and will make day-to-day life much better. And honestly, if an experienced nurse tells you, "I'm worried about this patient," listen carefully. That sentence alone has probably saved thousands of patients over the years. Write absolutely everything down. Organisation is generally one of the biggest FY1 survival skills, because your memory will betray you the second things become busy. You'll get 3 bleeps, 5 jobs, a discharge summary, someone needing insulin, and a consultant asking for blood results, all within about 7 minutes. So write everything down. I'd recommend a jobs list, checkboxes, and prioritising tasks into urgent, important, and routine. One of those pens with 4 colours in it can be really helpful, highlighting different jobs and their importance. For example, urgent, circle it in red, like chest pain, high news score, unwell patient review. Routine, you can circle it in green, rewriting drug charts, TTOs, and non-urgent bloods. The FY1s who cope best aren't necessarily the smartest, they're usually the most organised. Eat, drink, survive. Another thing nobody really tells you, if you don't deliberately eat and drink during your shifts, you genuinely may not remember. You'll look up at the clock and realise it's 4 p.m. and all that you've consumed is half a coffee, a little bit of stress, and 1 digestive biscuit. 3 days of that and you'll be calling in sick in no time. So, bring water, bring snacks, and ideally food that doesn't require emotional recovery to prepare. If you can meal prep, great. If not, try to have balanced foods that give you lots of slow-burning energy. Your brain functions better when you're not dehydrated and running entirely on cortisol. Comfortable shoes. Now this sounds boring until you've done 4 consecutive long shifts. FY1 is secretly just a walking simulator with occasional medicine sprinkled in. Good shoes matter more than most people realise. They can really make or break a shift. Part 3. Surviving bleeps. Now let's talk about bleeps, because honestly, the sound of a bleep going off during your first month of FY1 can increase your heart rate by about 40 beats instantly. One of the biggest things that helps is having a good solid structure that works for multiple situations. Whenever someone bleeps you, try to find out: who is the person bleeping? Which patient? What's the problem? What's the observations? What's the news score? What are they actually worried about? Because doctor, can you review this patient can mean mild pain or someone's actively trying to die. And if you're in the middle of something urgent, it's completely okay to say, I'm dealing with an emergency right now, I'll call back in 5 minutes. You do not need to teleport instantly to every task. And also, remember to write down the answers to their questions, because your brain will act like a sieve when you're stressed. Part 4. Medical tips for FY1. So let's start with chest pain. Chest pain is one of those classic FY1 panic bleeps, and the important thing is don't panic. Think systematically. What could this really be? ACS? PE? Pneumothorax? Or is it simply something like GORD or musculoskeletal pain? Start with the basics. Do an ECG, check observations, take bloods including a troponin and a D-dimer. Examine the patient and take a proper history. And if you're worried, then just escalate. You are not expected to independently manage every chest pain presentation alone. Next is the patient just doesn't look right. One phrase you should never ignore is the patient just doesn't look right, especially if it comes from experienced staff. Sometimes, patients deteriorate before numbers become dramatic. First things first, do an A to E assessment. It's your bread and butter and you can always fall back on it. Treat abnormalities as you go. Look at the patient properly and trust your instincts. If someone looks significantly unwell, then escalate early. Falls review. Falls are another classic FY1 job. And there are a few things you should always ask. Did they hit their head? Are they anticoagulated? Was it witnessed? Why did they fall? Was there a loss of consciousness? Any injuries? Always think, is this simply mechanical? Or is this actually sepsis, arrhythmia, hypertension, delirium, or something more serious? Remember, if you have any concern at all that they may be having a bleed, for example, they're on a DOAC, they have a reduced GCS, or they're vomiting, get a CT head. Also, my advice would be to x-ray any areas of pain on the body that are new, unless you're absolutely certain there is no fracture. Prescribing safely. Before prescribing almost anything, get into the habit of checking allergies, interactions, renal function, if relevant liver function, their weight, and the indication why you're actually prescribing the drug. One of the easiest ways to avoid mistakes as an FY1 is simply slowing down slightly before pressing prescribe. Next is sepsis. With sepsis, new FY1s sometimes get stuck trying to identify the perfect source immediately. But early on, this isn't important. The most important thing is recognizing deterioration. If someone is hypotensive, tachycardic, febrile, confused, or looks acutely unwell, especially of all of the above, then think sepsis. Start the sepsis 6 early and escalate. Give 3 and take 3. If you can do them in this order, then great. First, oxygen. 2, take blood cultures. 3, antibiotics. 4, IV fluids. 5, get a lactate. 6, measure the urine output. Part 5. Time-saving hacks. Use templates. One of the best time-saving things you can do is create mini templates for common reviews. For example, chest pain review, falls review, sepsis review, or ward round notes. Having structure massively reduces stress. Learn computer shortcuts. Every hospital computer system is painful in its own unique way, but learning shortcuts saves a ridiculous amount of time. Favorite bloods panel? Quick note templates, order sets. Tiny efficiencies add up hugely over months. Carry a mini cheat sheet. This is honestly one of the reasons I ended up making the on-call companion, because early on there are loads of things you repeatedly need quick reminders for. Electrolyte replacement, AKI management, common bleeps, insulin, fluids, escalation steps, and when you're stressed and sleep deprived, having quick reference information generally helps. Part 6. When you feel overwhelmed. Finally, you're going to have bad shifts. Every doctor does. You'll have shifts where you feel behind all day. You'll forget things, you'll feel stupid, you'll compare yourself to seniors who have literally had years more experience. That's all normal. A bad shift does not mean you're a bad doctor. And honestly, most FY1s are coping far less confidently than they appear. Medicine is hard. FY1 is hard. And you are learning an entirely new job in real time while looking after genuinely unwell people. So ask questions, debrief difficult shifts, talk to colleagues, escalate early, and remember, safe doctors ask for help. So, overall, you do not need to know everything on day one. You need to be safe, organised, willing to learn, and willing to ask for help when you need it. That's what makes a good FY1. If you found this helpful, subscribe for more FY1 survival tips, ward guides, and on-call advice. If you want quick reference cheat sheets for common ward problems and emergencies, check out the link below. Good luck. You'll probably do better than you think.